I'm going to record. So you're good to go.
Okay. Okay, well, I am going to get started. So good morning, everyone, and thank you so much for joining us this morning. This is actually part three of our introduction back into palliative medicine conferences and grand rounds and journal clubs. And so I'm really excited and happy to talk about this last bit, and I am going to try something new today. So if you're joining us, I am very grateful that you're here because this will hopefully be a lively and engaging discussion. And I know it's on Zoom, and I know that that's definitely has its own challenges to having a discussion on Zoom, but let me kind of go through a couple of things so you can see why I think this might be kind of an important thing to do. Okay. Let's see. There we go. So if you were able to join us for the first two talks, the first talk it's a marathon, not a sprint, long haul trauma and grief during COVID. And I particularly focused on healthcare workers because, again, I think this has gone on for longer than many of us anticipated, and definitely taken some twists and turns and headed off in some unexpected or maybe expected directions. I don't know, I definitely ran into a bunch of surprises, and it's been hard, and it's been definitely wearing on me, and I can see it wearing on my colleagues. And so I think just trying to figure out, how do we frame this? What are some tools that might be helpful to use, knowing that there might not be a finish line. There might just be, us learning to live with COVID. The second part, I really appreciated Dr. Fausto sharing his paper, creating a palliative care inpatient response plan for COVID. So hopefully most of you got to see how how we responded, UW Palliative Medicine responded, and tried to frame some guidelines and just some recommendations for how to proceed, and how palliative medicine might best support our healthcare systems during the pandemic. And part three is today. So welcome to our first hospice and palliative medicine community town hall. So again, I am trying something new, and I'm really hoping that it can be kind of a discussion. And part of the reason why this is part three is because I think, in parts 1 and 2, you got to hear from us a lot. And in fact, for that first part, I kind of ran out of time to have much of a discussion at all. And I think it definitely warrants having a discussion, and having a space where we as a palliative medicine and hospice community can kind of come together. And I use those terms very inclusively. So if you are somebody who is out in the community and joining our grand rounds, and you are caring for patients who are end of life or who have serious illness, and you are somebody who has been doing that during this pandemic, this includes you. And so that first part, I think I did talk a lot about the idea of ambiguous loss and grief and trauma, and a large part of kind of healing from that or processing that is getting together as a community, and is kind of hearing from each other and hearing from other people who have been going through maybe something similar, or who have been in the trenches with you, that you might not necessarily know or have seen, but we're doing maybe some similar work and maybe having some similar feelings. And I think COVID, as I mentioned, in that first part of the series has really robbed us of a lot of the ways that we do process and cope, and the tools that we use for resilience, like getting together as a community. And so I did want to create this space and try this out. Even though we're virtual, I'm really hoping that everyone feels empowered to at one point unmute themselves, and share their videos and join in. So the questions I kind of set out, in case you need a little bit of a framework to begin the discussion, which I think is always helpful, are listed here. And I kind of thought of it as that sort of big, now 100,000 foot view palliative care debrief that we always do, sort of that check-in after a family meeting. So how are you doing? Right? How did that go? So how are you and your colleagues or team doing? And what are you seeing? What are you seeing on your day-to-day rounds? In the work that you do? And I know that's a very general question, and it's meant to be general because I want to hear from you what that brings up and what you feel like you are seeing in your day-to-day work. And what is different from when COVID started compared to now, and what have you learned? And you got to see, if you joined us for the first part, what I felt was different between then and now. And I found this lovely meme of how it started and how it's going, that I felt was rather relevant and apropos to definitely how I view a little bit of how the pandemic is going. And then what challenges are you grappling with now? What challenges are you and maybe your team grappling with now in the setting of this continued long haul pandemic? And what do you worry about as we continue to move forward during these really challenging times? And finally, what are you and your team doing to survive? And you don't have to answer every single one of these questions. They're meant to generate conversation, and they're meant to kind of jog some ideas of maybe if you are willing to unmute yourself and share your video and share a little of what's going on at your site and what's going on at your clinical site, to give a starting point of some ideas that we might all want to hear from each other about. So I know some of you are joining us. Welcome, applicants. Very excited to see all of you on from outside of Washington. And some of you are joining us from inside of Washington. And I always put up this timeline when I'm talking about sort of COVID in Washington, so that people have a sense of how far we've come, what we've been going through, and how long we've been going through it. So I'm not going to belabor any of these points because I've gone over them previously, but let your eyes kind of wander over this timeline and really kind of just see how long we've been in this, right? So if you really look back, we've been in this for about 18 months, and really our first initial peak was March and April, when everything started shutting down and our nursing homes became the epicenter of this outbreak. And then we, kind of headed off into the summer, and ran into some financial issues that led to a lot of furloughs and in fact some layoffs. And then we kind of moved on to having some additional tools to kind of help us figure out what's going on and how to treat COVID. But we also, again, had some concerns for transmission amongst ourselves as healthcare workers. And as fall and winter began, we saw another bit of a surge, but there was some light at the end of the tunnel as the vaccines were emergently approved. And then here we are heading back into the summer, and Washington actually reopened with the vaccines, and a lot of our residents in Washington and King County and Seattle area getting vaccinated. So that was a quick run through of the timeline for those who are outside of Washington and kind of joining us for the first time. And you can kind of see our, it's very small, I'm sorry, but you can kind of see just our trend in numbers. So this is back in spring of 2021, heading into the summer when we all thought maybe we were getting through this and there would be an end point. And then now the surge that we're seeing from the Delta variant. And so kind of bringing us up to date now. We're in September, our kids are back in school, and we're seeing kind of these nationwide anti-mask, anti-vaccine protests. And I am somebody who does like to scroll through social media to kind of see where my fellow physicians and nursing colleagues are, and what's on their minds. And I have seen these two images come up so many times. And I think it just really speaks to where a lot of us are feeling right now in this pandemic, and that these two images kind of kept coming up and kept coming up, is a little distressing to me, in that we're feeling like we're drowning. We're feeling like we've already tried to be so positive and turn all of our lemons into lemonade, and it's exhausting. And can we keep doing it? And now we're just getting pelted. So again, I'm going to put up these questions, and I really want to save most of the time, this hour, for all of you out in the community. And I'm really hoping that, again, that if you feel empowered and comfortable to do so, and kind of touch on one of these questions or several of these questions, I think we'd all just love to hear from you, and we'd all love to hear from each other. And I think I've done more than my fair share of talking during these first couple of grand rounds and conferences. And so again, I do want to open it up to our community. I think what I'll do is put these questions in our chat, and then I'm going to stop screen sharing, and I'm going to hope that all of you feel comfortable, or at least some of you feel comfortable, and feel free to start your video if you have the bandwidth, and or unmute yourself, and really, we can jump in here. And then I know, okay, did that copy? Okay, great. And then I know our fellows, our palliative medicine fellows here, a lot of you may have come from other institutions, fellows and fellow applicants. And so, if you feel comfortable kind of sharing what's going on or what you saw, in your former life, compared to now what you're seeing maybe on your rotations on the wards, and then fellow applicants, we welcome you. And I know you're also coming from a diverse set of backgrounds and a diverse set of places and institutions. And so again, we've all kind of been focused here on our institution, and I would say in UW almost even more siloed within UW. And so I've invited a number of people from the community too. So I'm hoping that they might show up, even our long-term care or post-acute care colleagues who have been working in the skilled nursing facilities out in the Seattle area. And so again, just kind of inviting everybody to just jump in, and feel free to raise your hand, feel free to use the chat. And I'm happy to just kind of step back and moderate. And if I see someone's hand raised or I see a text in the chat, I will definitely bring our attention to it so that you feel comfortable having some space and time to give your answers to one of these questions. Okay. Any thoughts?
Hi, my name is Kathy Plakovic. I'm a nurse practitioner at Seattle Cancer Care Alliance doing palliative care there. Boy, so much. I would say the biggest thing that has changed is, we're doing 2 days a week in the clinic and 2 days a week at home doing telehealth. So telehealth was a huge transition, right? And I think a big part of what we do in palliative care is being present. And it was a hard transition to figure out how to do that in this medium. But I think I've figured it out. But it's difficult to have when you're meeting a person for the first time via a screen and really getting that connection and having these, serious conversations. It still is a challenge at times. And then telehealth has taken off. I mean, people love it, right? They don't have to schlep into the clinic and they, are able to be in the comfort of their home. And now there are days where I'm actually in clinic, but the majority of my visits are telehealth in the clinic. So it really has just changed the way that I practice. It's super isolating too, right? So there are, you used to come back to your office and you were able to debrief with your colleagues and you saw other humans during the day. And that's been challenging as well. So, I mean, we still have some opportunity to do that when I'm in the clinic, but it's, it has been very isolating.
Thank you so much, Kathy. I think you really kind of hit the nail on the head as far as like something that we've all kind of had to transition to, and it is really hard. I think, even this morning, right, on Zoom, I see all of you, but normally we'd be in a room together and we'd have usually some food or some goodies available, and we'd be like breaking bread together and having this discussion. And instead it just feels very kind of clinical even, right? Because we've already been using video conference and Zoom to see our patients, and now we're kind of looking at each other on this screen, and it's definitely very different. And you have to make, I know, the mental load of making that much more effort to kind of try to reach through the screen and connect with each other, I think is also just really challenging. And you're right, it does feel isolating because people that I used to run into in the hallway, or just, when before and after conference, just friends that I might catch up with for an extra minute or so before and after conference. Like, we don't get that. The Zoom feed cuts off and we go about the rest of our day. And it's really hard. And then particularly with our patient care, especially if you're somebody who, not only uses your words for communication, but even body language or like light touch to just say, like, reach out and be like, I'm here with you. It's really hard. So thank you for that.
Yeah, even be handing somebody a tissue, right?
Yes.
I just miss being able to give that gesture when it's needed, right?
Totally. Yeah, you almost feel even more helpless when someone's crying, and you really need to focus on, like, what are the supportive nurse statements I'm going to make, and and you don't have that extra ability to reach out and touch someone and just say, like, it's okay.
So Annie, there's a good comment in the chat box, or a comment in the chat box. I don't know if someone's going to read those out or what's helpful.
I just saw that, Jim, so thank you. Yes. Chris, do you feel comfortable in muting yourself? I can also read your comment. It's okay if you're, I think, you're expressing a lot of what we feel too, that we're just all exhausted. And what amazing work you're doing for our Indigenous folks. And I think that's really particularly hard. And so Chris is just saying lots of challenges, not just with COVID-19, but with the patients and families who are suffering because our hospital is locked down. There are limited opportunities for specialty care, elective surgeries, etc. Then there are the unvaccinated patients who are taking ivermectin. And I think that's definitely a challenge that a lot of us have seen, where we've gotten maybe requests for ivermectin or for treatments that are unproven or potentially even harmful. And there's so much misinformation out there. It feels like we're fighting this war against all this misinformation. And I think that definitely we have seen some of our Native American or indigenous population in Washington state coming through Harborview very, very sick on ECMO or in the ICU on ventilators. And that's been particularly hard and challenging for that community. And for so many of us seeing them, their families are often, it's not usually just that one patient. Their families are also sick. So, we might see a young patient in their 40s, and when we call their family's isolating, but also grandma has died, and also patient's sister is in another hospital on an ICU, or patient's mother is dying of COVID. And so it feels like it's just this incredible all around loss for these communities, and it feels like there's no stopgap. I think it's particularly hard to see those vulnerable communities, right? I'm sorry, go ahead, Chris.
Sure, I'll just comment on it. It seems like there's space for that. Yeah, it's been particularly tough. A lot of us are talking about our Zoom experience, and for me, that hasn't been much of a thing. I do home visits, as I noted, and then work in the clinic. And I've been in our respiratory clinic a couple of days a week, and then only missed about a month of home visits. And most of our population on the reservation, I'm at the Lummi clinic up here in Bellingham. They don't have cell service. Zoom isn't really an option unless they can come to our clinic and hang out in the parking lot, and then we get them iPads or figure out some other way to do it. But what I'm seeing is just the pandemic, but also the kind of residual, the collateral, if you will, where people can't get their regular care, which can be challenging enough. We get somebody in the clinic and we're doing everything. We're dealing with whatever current crisis they have, but also trying to make sure that, we've checked on their on their primary care stuff. We've gotten them connected to the dentist, whatever it might be. You really want to grab folks when you can. Population that is often distrustful of medicine for good reason. Some of these institutions haven't treated them well. And so this has made it so much harder during this pandemic to actually reach these folks and be able to provide that care. So I think we're going to see, I certainly have already, but I think it's going to become more of a thing with the lack of preventative care and just this regular maintenance that we might have been able to do normally. It is not happening. It's not happening anywhere near as robustly as it would have otherwise. And that's really frustrating too, on top of, what's going on with the pandemic and all the sick people and families that can't go visit loved ones at the hospital, et cetera. So yeah, it's a very tough situation, and I was excited this summer when things looked better. I had to my team, I just declared COVID over this summer about August, and jokingly, of course, and that did not turn out to be true. So hopefully we can learn to live well with this illness that seems to be with us.
Oh, well said. So many points there. Yeah. And I think, we all, first of all, thank you for the amazing work that you're doing, because I think that's hard. A lot of the work that we're doing for all of us, I think, just tends to take that emotional toll too nowadays. Whereas before, like, a lot of it was clinical, and we do palliative medicine, and there are sad cases. There are really amazing cases where it's you almost feel like you're witnessing some small miracles. And it's actually very uplifting work. And I think the pandemic has erred more on the side of just really heartbreaking, difficult, challenging work. And that's worn down on us. So thank you so much for everything that you're doing, and yeah, for touching on some of the really challenging parts of the work. And it's interesting to hear, you know, it is, so yeah, a lot of us are in these little Zoom boxes, but you know, those of us, and I know hospice is one of those groups too, who are still out there going to do home visits and going into see patients face to face. That can also be very challenging work as well. Yeah.
Hi, this is Aaliyah Moore. I'm an interviewee. I'm going to dive right in. I'm a physician in Los Angeles, and I currently work in the Los Angeles County Jail. And I think one of the most jarring things for me has just been this push to return to normalcy in the face of ongoing crisis. So the best illustration I have is in the jail. When the pandemic first started, there was a concerted effort to reduce the population so that patients wouldn't be crowding together, and so there would be less risk of transmission of the illness. We have up to 20,000 inmates at a time, and we got it down to like 10,000. And when things started to look better, the sheriff's department started arresting more people and started building up the population again. And now we're basically back to pre-pandemic numbers, even though the pandemic is still happening. We're having surges over and over again. And I think that that's something we're kind of seeing everywhere. We're in the general population. A lot of people are pretending like this isn't happening, even though it very much is. And it makes me sometimes feel like I'm living in a different reality from a lot of my patients and a lot of the people around me. So that's rough.
Thank you so much, Aaliyah. I think you really gave voice to so much of what all of us are living through, where, my gosh, you know, I think a lot of us were so optimistic in June and July because our numbers were going down, and you know, we had been through so much, and all of us so desperately wanted to see the end of this. During my first kind of grand rounds presentation, I mentioned that I think we're not the only ones, right? You're right, that like the general public, so many people were like, we're done, we're through. And you saw all these celebratory pictures of people in New York going out and going back to Broadway, and people having parties and going to outdoor concerts and clubs, and even the national societies that we're a part of as physicians and clinicians, AHPM, AGS, all booked their 2022 springtime conferences in person. So AHPM is going to be held in Nashville, and AGS is going to be held in Orlando, Florida. So I think we're not the only ones that, like, you know, doctors, nurses, clinicians, like all of us were very hopeful, and to the point where our, you know, our professional societies even booked in-person conferences. And what a roller coaster ride and horrible flipping of the script that we're now dealing with this Delta surge, that we kind of maybe saw in our periphery, but maybe didn't want to believe was going to take over the way it did. And even I think the head of our infectious disease in response to COVID, Dr. John Lynch, was saying, like, I just really did not expect Delta to take over as quickly as it did. And what whiplash for everyone. And you're right, I constantly feel, as I think many folks do in healthcare, that we're living in this these two separate realities, that there's this reality that people are living in where we're through COVID, we're fine, we can go out and we don't have to mask, and why are you telling us to still mask? And then there's the reality that we're living in where we're seeing people dying we're seeing the consequences of living like you think COVID is over. And that's incredibly hard too. So thank you for being willing to share and give us some insight into a population that we, I think, never really have as folks who don't work in the jail. Unless you work in the jail, I think you really don't have a great window into what care in our jail or prison systems is like. And you see the patients, at least at Harborview, we see the patients that come from jail, but we don't get to see, you know, on a deeper level what the care is like and the challenges that I'm sure you must face there.
Annie, I'm just going to piggyback on that for a moment, if it's okay. And I think, and hopefully I'm not navel gazing too much in the world of palliative care, but I think pre-pandemic, if you worked in palliative care or you worked in some tough area of healthcare like cancer care, and you're at like a Thanksgiving dinner or social gathering and people ask you, what do you do? You start talking about what you do, it can often be a showstopper and people want to move on, and that sort of technique of societal denial of things that are hard, and we just don't go there. I think at the beginning of the pandemic, it was much more like, we're going to get through this together. And I'm actually seeing more of that behavior. I think I had a conversation with my brother a week or so ago, and just trying to say how hard it is to be in healthcare right now. And he just sort of shut down and moved on. And so I think, and I think denial is a really powerful coping technique, and people have used it for millennia. So it's not a critique of that, but I think it's an observation. And I think to that end, the way healthcare people, in my perspective, have gotten through tough work is to rely on each other. And I see that happening. And I guess I just encourage that again, because I think a lot of people they don't want to hear about it anymore. And they intentionally are trying to be in a different dimension or a different reality because they can't cope. And that's tough for people in healthcare, but it's, I think in some ways it's a unique situation to be dealing with this, but it's not unfamiliar. So I think that's just my thoughts this morning. Thanks.
Thanks, Jim. Again, I just feel like it further speaks to how isolating this has been in so many different ways and on so many different levels. And yeah, not just the Zoom and not just the silos that we were already in pre-pandemic, but to have society kind of denying our experiences it's hurtful. I do see that some of our UW post-acute care providers are on, and so I just want to make sure that they feel empowered to share as well or give any insights, because I did specifically reach out to them and invite them as well. I know about a year ago, we actually had a panel discussion with our UW post-acute care providers because they were on the front lines in the world of skilled nursing facilities, and they developed this amazing response to COVID in the skilled nursing facilities that they had to put together very, very quickly to try to protect and treat a lot of our most vulnerable elderly and long-term care patients in our skilled nursing facilities. And that was really the epicenter of the outbreak here in Seattle. And so I invite Dana and Ibrahim, I see you. I'm sorry, I don't want to call you out, but just an invitation. There's questions in the chat that if that helps kind of frame any things that you want to share or ideas that you have. It's at the top of the chat. just feel free to kind of look them over and jump in, because I know both of you have been working so hard for the past, gosh, 18 months in some of the hardest hit, and sometimes the scariest environments, definitely at the beginning of the pandemic, when we didn't know what this was and we weren't sure we would have enough PPE, and at some points actually in the skilled nursing facility didn't have enough PPE.
Hi, everyone. My name is Dana Lay. I'm one of the nurse practitioners for the Post-Acute Care Service. Thank you for inviting us to this discussion. I think it's a really wonderful debrief. Gosh, where to begin? I think I hear a lot of the experiences, and I think they echo and resonate with our team's experience. And Chris, I think in particular, your comments about being exhausted really resonates. Sorry, I'm getting really emotional. I must say that I'm incredibly resentful of the general public. I wholeheartedly hear you guys when you say that you're exhausted. And I vacillate between trying to be normal, because I have young children, and I also want to be in a space where I can feel like I can go out and, take my kids to their soccer game without worrying about whether they're going to get COVID, because they're young. I have a 2-year-old and a 7-year-old. And the other piece of it is I'm jealous, right? I'm jealous of the people that get to go to do their normal things and stay home with their kids while they work remotely on Zoom. Our team has been in the skilled nursing facilities throughout the pandemic. Like Annie said, we initially responded by, for those of you that don't know, UW Medicine has a network of skilled nursing facilities where we have clinical providers. And so our team's initial response to kind of help, because we were all feeling very helpless in the beginning, was to create drop teams so that we can help skilled nursing facilities test rapidly. And UW Medicine and the laboratory was really supportive of that. And so they gave us the PPEs, the N95s, and all of those things that were required to go in. So I think that felt really hopeful, because we were able to do something, even though it was really scary in the beginning, because we were obviously exposing ourselves to potential COVID and bringing that home to our families. And then for a period of time, the skilled nursing facilities actually asked that no healthcare providers come in, because obviously we were working in settings where we were potentially exposed. And so for a very brief time, we did Zoom, which, like all of you echo, feels incredibly odd to have care conferences and goals of care conversations with patients that are incredibly sick, stuck in an institution where they can't see them, where I haven't seen them, and then telling their family members that maybe they're not doing very well and we should maybe transition to comfort care. Some of that is still happening. Our skilled nursing partners are still incredibly conservative right now, and there are still cases. And so even though the vaccination rates between staff are, I think in the Seattle area, a little bit better, it still varies between 50 to 80%. There's still a lot of hesitancy with vaccination among staff. And so there's a lot of shortage at this point, nursing shortage, aid shortage, as you're all probably seeing in the hospital setting and in the clinic settings as well. So I see a lot of exhaustion. I just see a lot of burnout. And rightly so. It's been a really long time that as a healthcare team and as a healthcare system, we've been really carrying this burden. And so it's been tough, but I think our team has been incredibly resilient. We've we've tried to keep some semblance of normalcy. We have lots of check-ins with each other. Although it's been a very long time since we've seen each other. So like I said, I think initially the drop teams felt nice because we were able to do stuff, but now I think as this has gone on longer, it has felt more and more, I don't want to say hopeless because I'm still hopeful, but exhausting and a little resentful, I think are the two words that kind of come up.
Hi everyone, Ibrahima. I'm with the PostAcute Care team as well. I think Dana pretty much covered everything. Exhaustion is the main word when you come to nursing homes. Everyone is exhausted, including the staff, the administrative. The nurses are pulling double shifts almost every day where I work at Park Ridge. And it's really tough. They've been hiring agency nurses here and there, and it's not covering it. It's really tough right now. The nursing aides, the same thing. It just feels like they are not having new hires for nursing aides anymore. Like no one is going into the nursing aid field or as a starter. So they are lacking a lot of nursing aides as well. So we all, I mean, our team, we are okay. We backing each other here, but yeah. Hopefully there is light at the tunnel nearby.
Well, I'm just trying to compose myself before responding because you guys know that my heart is totally with you. And
yeah, I mean, it's tough, but we are doing just fine. We are supporting each other as we saw. Especially Dana, she's been checking on every one of us.
Yes, in my former life, I was actually a member of the UW Post-Acute Care Service and worked with both Ibrahima and Dana, and they are two of the most amazing and just wonderful, innovative people, hardworking, and I can't imagine what it's been like for you. I stepped out of my medical director position right before this pandemic, I think, kind of hit, and it was, and I think it's been hard for me to watch the nursing homes struggle through this, because if you've ever worked in a nursing home or you've ever been in a nursing home, you know that they're already operating on such a thin margin that any disruption to the already just thin margin is going to, it's like a house of cards, right? It just comes down. And you're right that this pandemic has caused a nationwide nursing shortage, and where the skilled nursing facilities used to be able to get new nursing grads who then would oftentimes go and work in the hospital after getting some experience in the skilled nursing facilities, that stream has dried up because there's such a severe nursing shortage. And so again, you have this system that's already operating on such a thin margin, and then to have any disruption just leads to exposure of how thin that margin was. And I think being a clinician in the skilled nursing facility, I think, it's I think that you both touched on how hard it is kind of to witness this place where you work and have patients that you care about and staff, nursing home staff that you care about too, just struggling. And it's really hard to see. And so I think it's just really hard to remain resilient and remain hopeful. So I'm glad to hear that through this, sounds like most of us have maintained some little bit of hope. But it's hard to hang on to, and I just, it's really am grateful to all the work that you do for those patients. And I know both of you are also supporting the staff that is there, and that can be really hard too. I think Dana and Ibrahima also mentioned just what they're doing to kind of keep their team resilient and afloat a little, and that's a lot of checking in. I'm kind of curious what other folks are doing. I know with my team, Palliative Care at Harborview inpatient team, I am so grateful to be able to come to work actually and see my colleagues at work and know that I'm not alone. And that's been really important, to know that I'm not the only one having the feelings that I'm having or having the thoughts that I'm having, and then having a safe space to be able to voice those thoughts. Sort of like Dana, I hold some resentments as well when I see, our unvaccinated folks, or just hear people kind of on TV or in the news, saying things that I know are just perpetuating ideas that will lead to behaviors that are very potentially dangerous and harmful, that might lead to me seeing more patients dying in the hospital, or more patients just incredibly sick in the hospital. And so just being able to have a safe space to like voice that I'm angry and frustrated, and that it's hard to hear those things, has been really helpful as well. But what are there things that others of you out there are doing to kind of keep going through this?
Hi, I'm Megan. I'm a nurse with the SCCA Palliative Care team. I feel very lucky. I transitioned to the Palliative Care team mid-pandemic. So I feel very lucky to be within Palliative Care now, because I do feel my other team was wonderful, but this team especially is just so, they truly care about each other, and I just feel cared for in a very full way of my whole person. So I just love that our team, we do team huddles and we rotate which days the nurses are in clinic. So you never just see, it's not every Monday that I'm at home, it's every other Monday. And so I rotate which nurse practitioners I get to see, which is nice, because in my other care team, you'd go months without seeing somebody if your days at home were different. And I love that our palliative care team is honest with our emotions. I think in other workplaces I've been in, it was an expectation that you said you were fine, and people didn't want to know or dive in if you weren't, which was particularly challenging for me in the middle of the pandemic, which was the first year I struggled a lot. So I feel so grateful to be here with people being vulnerable and sharing their emotions, and it helps me move on from that emotion in a healthier way than when I was pushed not to express it. So I just think the dynamics of our team are what are keeping me afloat.
Thank you so much, Megan. I think, a lot of us are grateful to have our teams, and I agree, sometimes you just need to vent a little, and it doesn't mean necessarily that we can't, that we're angry at our patients or angry at their families, but I think it means that we just need a safe space to kind of let off some steam so that we can continue to treat our patients and their families compassionately when they show up on our in our units, and so we don't have compassion fatigue, right? Like we all need that safe space and to be able to just speak our truth and get it off our chest, and that too makes us, also maybe not feel so alone.
Though I'm not a clinician in the room, I'm Shanitra. I'm the program administrator for geriatrics and palliative medicine fellowships. And through this pandemic, a lot has changed to my workflows. But some of what I've been doing to try to stay resilient through this, there have been a lot of ups and downs through it. But I think connecting was one of the things that I realized that I really did need when we were disconnected. So being intentional in those efforts with the other leaders in fellowship, my fellows, and also encouraging and being intentional with self-care to preserve my mental health and encouraging those around me, because it's not stopping and we see where this is going. It's increasing, but if I can just sort of try to be a light and an example, that's what I hope that I've done by planting a seed, is to just take care of yourself. And even if you have to redefine what that looks like, because maybe what self-care used to look like pre-pandemic, it doesn't look like that now, but some things, maybe it's just as simple as going for a walk, letting the sun hit your face, turning on some music that will soothe your soul and just center you a little bit, can give you some sense of calm through this to keep going on. I think that's one of the things that I've been trying to practice intentionally to keep going.
Thank you so much, Nitra, because I know I'm one of the folks who has benefited from your efforts to remain connected. And I know last year's fellows definitely felt that during the pandemic, just having some extra space with you as just a supportive extra layer of presence and safe space for them to voice any concerns or feelings that were coming up for them, in the middle of a pandemic that they didn't bargain for in their palliative medicine fellowship, has been incredibly helpful. And so, again, I think we all need those safe spaces, and yeah, and we all just, it's hard because you, on top of everything else, you're having to like work even harder to try to reach out and make those connections, because this pandemic has just been so isolating. So I know our time is starting to wind down. But I do like giving the full 7 seconds of silence to allow for any other folks to jump in.
this is Lauren. I'm a nurse practitioner at Valley Medical Center, and I just wanted to say thank you so much for, Annie, your presentation. I just felt like, well, first of all, for me personally, it was helpful to hear the perspective that this will continue. I feel like that was probably in the back of my mind somewhere, but like I hadn't really accepted it until I listened to your presentation. And I just think a lot of it had to do with kind of like this whiplash of like, oh, things are getting better, as we've all experienced. And I think, I was listening to a Jerry Powell podcast earlier on, and I don't know when it was in the spring, and they were like, don't wear masks because the science shows that it's safe not to wear masks. And so I was like, okay, then I won't wear a mask. Obviously that was a while ago, but it just feels like, we're doing our best and we still have no idea what to expect in the next month. And so I think I kind of just like shut down and was like, okay, like I'm just gonna put my head down and do what I gotta do. But it is helpful to be able to accept that, this is reality and it may change again, but hopefully if it changes, that's great. And then things are actually getting better. But again, it was just really helpful to hear that. And then I really liked the question that you posed about whether or not our grief has diverged from the collective. And I don't have an answer, but I almost want to say that like the grief that we experience as healthcare workers, and then maybe like more specifically as a palliative care community, has like never been part of the collective. And I want to believe that it has, because no one in the entire world has been immune from COVID in some way. And so you think, oh, people have to understand like how bad this is and how important it is to do well for your neighbor and wear a mask or get vaccinated. But then you run into parts of society or communities that just are not living in your reality. And I really like, how, we are living in, it feels like we're living in an alternative reality. So again, I don't have an answer, but it just feels like, no, our grief is not the same as everyone's. But it is, and it isn't. It's obviously very complicated. But I just really appreciate this forum as well, just to hear from everyone and just to know that there are people out there who have experiences that are similar and who understand. So thank you.
Thank you so much, Lauren. I think, I agree that it is kind of mind-boggling, isn't it? Because you're right. It's like, we're all in this together. Like, surely you must see, we're all in this together. We're all suffering here. But it's just such an interesting thing to think about, that is our grief and what we're seeing so different and so divergent, because, people watch the news. Like, there are still stories out there of people ending up in the ICU, or young people dying from COVID and leaving behind young families. And so, part of me is like, you get it, right? You get it, world, right? Society. But it does seem very different, and it is a little like jarring to just, because I think all of us kind of want to connect, right? We all want to connect with those around us, and to hear something so different. I mean, even within Harborview, I'm on the medicine wards right now. And one of the nurses was really upset about the recent vaccine mandates, and especially here at UW. And she said, well, you guys are creating a class of second-class citizens, and you're discriminating against me. And she she was saying like, this is like the first step of descent into Nazi Germany. And I was like, wow, I'm hearing that in my medicine team room at Harborview, and it's so mind-blowing to me, because we're here and we're seeing the same patients, and that's your takeaway, and it's so different from my takeaway from this whole situation. And she's a friend and I like her, but sometimes it's just so hard for me to understand, I think, how we see the situation in such different ways. So thank you for that. And I think I definitely just want to say, because we're at the end of our hour, that I see every one of you and I see all of your names. And I want to thank you for the work that you're doing, because it's not easy. And I think it's important to just say out loud that you're not alone. And even if you didn't speak up today, I see your name on our screen, and know that I know you, and I'm seeing you, and I think most of you know me. And we're here with you because we are all part of this community. And I hope that you'll continue to join us on these grand rounds and conferences. They won't all be like this. We are going back to a bit more of a traditional conference, didactic type of grand rounds starting next week. And I want to invite all of you back for our fantastic spiritual care panel, something that I look forward to each year to learn more about the various faiths and faith providers in our community, and how they interact with our patients, and how they support our patients through serious illness, and in a slightly different scope than probably we all do. So very grateful for all of you who joined us this morning. Again, you're not alone. We're in this, at least we are in this together. Right?